Following your hip replacement surgery, you will need to follow your hip precautions for 6 weeks after your operation. Your hip precautions are as follows. Do not bend more than 90 degrees at your hip, do not cross your legs whilst sitting, and do not rotate your foot or knee inwards. So things to think about at home: you need to avoid sitting on low furniture, avoid bending into low cupboards or drawers, avoiding bending to pick things up from the floor, and twisting to reach for objects. This is the reason we ask you to take a number of measurements before you attend the pre-op therapy class. The OT will use these to decide if you need any equipment at home after your operation. The next clip will show you how to accurately measure your knee to floor measurement, which is something you might hear the OT mention. So using a tape measure, you need to measure from the back of your knee crease down to the floor. To make sure you are not bending too far at your hip, we need to make sure your furniture is a minimum of 2 inches higher than this measurement. The next clip will show you how to safely get in and out of your bed after your hip replacement surgery. And as we previously said, your bed needs to be 2 inches higher than your knee to floor measurement. It doesn't matter which side of the bed you get in or out of, but you may wish to use the side that is close to the bathroom at home if you need to get up in the night. So first of all, you need to ensure that you're as close to the head of the bed as possible and lower yourself onto the bed slowly. So using your arms, shuffle yourself onto the bed as far back as possible. Carefully bring your legs onto the middle of the bed whilst leaning back slightly to comply with your hip precautions. Remember not to reach forward in the bed for the covers due to your hip precautions. When getting out of bed, sit up, remembering not to lean too far forwards, and walk your legs to the side of the bed you are getting out of. Use your arms to help you shuffle to lower your feet onto the floor. The next clip will show you how to sit and stand from your chair safely whilst using elbow crutches. As we said previously, your furniture, including your chair, needs to be 2 inches higher than your knee to floor measurement. If your chair is too low, we may be able to raise it, or you may have to organise an alternative chair of your own. We advise you to use an armchair after the operation as it's easier to get out of. So using your arms to assist, shuffle your bottom to the edge of the chair. Have your crutches nearby so you do not have to twist or stretch too far to reach for them. Bring your crutches in front of you in a H position and stand with one hand on the arm of the chair and one hand on the handles of the crutches. Once in standing, you should then be able to safely put your arms into the crutches. When sitting down, make sure you feel the chair at the back of your legs and then place your crutches in the H position. It is important to remove your crutches prior to sitting down to prevent injury to your shoulders. Resting one hand on the crutches, the other hand is then free to reach for the chair arm. You are able to lower yourself slowly onto the chair whilst keeping your operated leg out straight. These items will help you to dress your lower half to prevent you from bending too far and breaking your hip precautions. You may need to purchase these items privately prior to your operation, depending on where you live. This is used to help put on your socks. Always remember to dress your operated leg first. It does take a little bit of practice to get the right technique, so please practice before you come in for your operation. Fold the plastic section to form a tube with the smooth side on the outside. It is easier if you wedge the aid between your knees so that both of your hands are free. You can then fold the sock onto the aid and hook over the side tabs, ensuring the sock is rolled up neatly, as this will make it easier for you. Pull the ears apart to open up the sock aid as much as possible. Place the aid on the floor, retaining one pull loop in each hand, and wriggle your toes to the end of the sock and steadily pull on the tapes. Your helping hand can be used when putting your underwear or trousers on. This aid can take a little bit of practice to get the right technique, so try and practice before your operation if possible. Always remember to dress your operated leg first, and we recommend wearing loose fitting clothes after your operation. So first of all, lay the item of clothing on your knee and using the helping hand, hook and secure the item. Drop the item to the floor and dress your operated leg, pulling the item of clothing as far up your leg as possible. The item of clothing should now be in a position where it won't drop to the floor, and you can therefore release it from the helping hand and dress your unoperated side, again using the helping hand. Once secure, you are then able to stand to pull up the item of clothing. It is normal to have some swelling after your operation, so if your shoes are a little bit tight now, you may benefit from purchasing a bigger size slipper or shoe. We advise you to avoid lace shoes, and a full shoe is more secure for when you are walking after your operation. So using the long handled shoe horn, place the shoe horn at the back of the shoe, put the front of your foot into your shoe or slipper first, and then slide your heel down the shoe horn. And then the opposite for when taking your shoes or slippers off. These exercises should have been demonstrated to you at the pre-op therapy hip class, and this video will provide you with a refresher of these exercises. We recommend they are done 4 to 5 times a day. The first exercise is to be done whilst on the bed. Lie on your back with your legs straight. So pull your toes up towards you and push your knees down firmly into the bed. Hold for 5 seconds and relax. Repeat as directed by your physio. So in standing or sitting, tense your buttocks, hold for 5 seconds and repeat as directed by your physio. So whilst standing upright, holding onto a secure surface, bring your leg backwards, keeping your knee straight. Do not lean forwards, and repeat as directed by your physio. Stand upright again whilst holding onto a secure surface. Bring one leg slightly backwards, bend your knee and lift your foot behind you, trying to get your heel to your bottom. Repeat as directed by your physio. So whilst standing upright, holding onto a secure surface, lift your hip and knee gently upwards towards your chest, taking care not to go past 90 degrees at your hip. Repeat as directed by your physio. Number 6, standing upright whilst holding onto a secure surface. Lift your leg out to the side whilst keeping your toes pointing forwards, and then return to the start position. Again, repeat as directed by your physio. upright whilst holding onto a secure surface. Slowly lower your knees to bend over your toes. Repeat as directed by your physio. So some general safety tips to remember for after your operation include removing any obstacles such as loose rugs or wires, which may be a trip hazard for after your operation. Remember to wear supportive shoes, avoid wet floors, ensure that you have good lighting in hallways and stairs, and ensure that any stair rails you have in place are securely fitted to the wall. The next clip will show how to use the stairs safely whilst using elbow crutches. So when going upstairs, hold the handrail and place the elbow crutch in the other as shown. Step up with your unoperated leg and push through the rail and the crutch and step up with your operated leg. Bring the elbow crutch onto the same step and always go up one step at a time. When going downstairs, put your crutch onto the lower step, take your weight through the crutch and the handrail and step down with your operated leg first. Follow with your unoperated leg. The next clip will show you how to get in and out of a car safely after your hip operation. Some low-seated and very high-seated cars may not be suitable, for example sports cars or 4x4s. When travelling in a car, it is important that your hip precautions are followed at all times and always travel in the front passenger seat. You can add a cushion to increase the height of the seat or use a plastic bag to help you turn into the car more easily, but please remember to remove it before the car sets off. Ensure the car is parked on level ground away from the curb. Have the car seat as far back as possible and in a semi-reclined position. Step back to the car until you are able to feel it behind your legs. Lower yourself slowly back onto the seat, sliding your operated leg out in front of you. Slide yourself back as far as possible, keeping your operated leg out straight, and slowly turn without twisting to face forwards whilst carefully lifting your legs into the car. Once seated, keep your legs out straight. To get out of the car, open the door and slowly turn towards the exit whilst lifting your legs out of the car. Avoid bending too far or twisting your hip.